I mean, there's so many services that are offered by the hospital,
Yes.
and I mean, it was obviously a great place to put that type of questionnaire if one was to be provided. Is that something that you're looking at as well as putting that just basically on the hospital website and saying, if you have suggestions, for instance, almost like a suggestion box, I guess?
Yeah. So the answer, let me just walk you through how we're going to approach the website. Currently, there is a lot of information on the website of our hospital, but it doesn't, in May, early May, we hope to enhance the website to include pages that will tell, what I refer to as tell our story. And what we want to do is educate and inform our community about the complexities of running a hospital in our current environment. And so that will include information about how hospitals are funded, the cost pressures that we're under, and also information about how we will be engaging them in the dialogue around scope of services. So the intent of the website is one strategy of sharing information and also engaging them. Now, as going back to our earlier discussion about trying to solicit as many perspectives of the community as possible, in hearing the feedback I received this morning at the Poverty Reduction Committee, we know that there's a population that doesn't have telephones. We know that they don't have access to internet or computers, or they may not even have, from a literacy perspective, have those. So we've already made the connection with the individuals that sit on that committee as to how we're going to be able to reach out and get their voice to the table around how do we reach out for the dialogue with them. So I don't have specific answers around what those channels and those means will look like today, but that's the work that we're doing in the coming weeks and months as we prepare for that full engagement.
So not only do you have to work out a strategy, obviously, for this current budget crunch, but there also has to be a strategy, obviously, long-term.
Yes.
And a part of what we're talking about right now with regards to delivery of service is in fact, that perspective, isn't it? It's about thinking long-term.
Yeah.
Right. Is there a strategy, is there a specific strategy the hospital is looking for? I mean, we're talking about the future of healthcare now, right?
Yeah. So the hospital does have a strategic plan that was developed a number of years ago, and it gets refreshed on an annual basis. So we'll be refreshing that strategic plan over the similar time frame over the next number of months in preparation for the fall. In terms of what I see in terms of areas that will need attention in terms of our current strategy, is that one, the whole aspect of community engagement will be strengthened. There is an expectation, and rightly so, that we continue the work with other health service providers to better integrate our services in partnership and try to be, from a health systems perspective, provide better coordination of care for our community. And in some respects, there's opportunities for consolidating some of our overhead costs and try to share those costs with our other hospitals, for example. So we'll be exploring those opportunities. And then, of course, we want to look at our scope of services. So that's the dialogue that we just had in terms of making some choices if we have to. I want to certainly reiterate that the discussion around services and choices of services really is the last resort for us. We're committed as a board to pursue efficiencies first, both internally and working with other health service providers as a first priority. And failing us being able to find sufficient efficiencies, then we need to have that dialogue about scope of services. So it's really the second part of the strategy. But it's important to keep that in mind moving forward.
Now, what has I don't know if support's the right word, but what has the response been from the LHIN concerning the strategies that you've implemented thus far and the direction you're going?
Well, certainly we started off with a $2 million operating deficit, which represents 3.6% of our total expenses. And so that's a very significant challenge for us. We met with them a number of weeks ago and walked through the budget plan, and they were very pleased with the progress. And on a similar note as our board and myself, we remain concerned about the remaining deficit, but they were pleased with the direction. They're also very supportive of the community engagement approach that we're taking, and certainly have lended their support as we move forward. So, and I should also mention as well that community engagement is required under law now, that as health service providers, hospitals included, as they start making changes to services, whether it's an increase or or a new service, or whether it's a reduction of services or even integration where we work with other health service providers, there is an expectation in law that we go out to our community and have and receive public input on those decisions. So the work that we're doing now is really intended to lay the groundwork for that expectation.
Well, I know that the workload's obviously increased hugely with the closure of the walk-in clinic, the demand for general practitioners. How is the hospital handling that situation?
Yeah, absolutely. We live in a community that is growing, so we're higher than provincial average in growth. We live in a community that is aging. Actually, Cobourg, part of our community, Cobourg, for example, is, I believe, the second oldest population in Ontario, one of the stats I recently saw. So we have an aging population, and that has implications in terms of the resources that are required to support that population. So we have certainly some challenges before us. We also have a shortage of health service professionals. The medical staff, particularly, and physicians are an issue for our community and our hospital. So on that front, one of my priorities in the coming months is to address some of those shortages. And in emergency department, we have shortages of physicians. We have to fill those unfilled shifts by having to bring in physicians from other communities, and that there's an additional cost of doing that. So we're hoping to solidify and bring in a new chief of department, emergency department, that will help create that leadership structure to what we need.
Well, and you just brought on a new doctor, is that correct?
Yeah, there are a number of new doctors that have come on through the Northumberland Physician Recruitment Committee, which is supported by all the municipalities and also the hospital and also other individuals support that committee. So we've, as a committee, been very successful in bringing in a number of general practitioners or family doctors into the community, two recent ones, as you know. So that certainly has helped, and some of those physicians have chosen to continue to, or chosen to support providing services to the hospital, like the emergency department. So that's good news. Some family practitioners choose only to focus on the community-based care and not provide services to the hospital like obstetrics or emergency care. So depending on the physician, we certainly are pleased with those physicians that are supporting the hospital, and that makes our services more viable for the future.
Well, how have you found your first 6 months?
Well, first of all, I have to say that it's a wonderful hospital. We are very fortunate for this community to have a hospital that is well equipped, that is a relatively new facility, as you know, and having a scope of services like MRI in a community of this size really is something that we should be very proud of, but more importantly, it really serves our community well. Access to care close to home is certainly delivered here. So on that front, well-positioned hospital. But what's really rewarding for me is that we have a culture in this hospital that is very team-based. There aren't dynamics that are prevalent in other hospitals where physicians and administration are at odds, or the board and the foundation are at odds. This is a community hospital that gets it. They get it in terms of this is in order to work effectively together, you need teamwork, and it's a wonderful culture. And so the budget that we just released, Phase 1, is really reflective of that mindset. Everybody contributed. They recognize that there are tough decisions that are having to be made and choices moving forward, but they're prepared to support the process. And so from that perspective, it's made my job a lot easier. I'm not having to worry about relationships and team building because it's already there. And the community should really understand the value that brings to, because if the team is working effectively together, that has an impact on the quality of care we provide. So it really is a wonderful place to work.